Testing elbow flexion against gravity position. Patient will be in a seated position with arm resting comfortably outside. What you will have your patient first do is perform full elbow flexion. Go ahead and do that for me. Bring it back down. Because she's able to do this, I know that she's at least a 3. Now, when you test elbow flexion, what we're going to be doing is we're going to be testing for 3 different muscles: the biceps brachii, the brachioradialis, and the brachialis. To first do the biceps brachii, you will have your patient's palm facing forward, and when she comes up, she will kind of be in a spoon, like, you know, kind of lifting something up in that motion. So go ahead and do that for me, and come back down. So that's a 3 for that muscle. Come up about halfway. I'm going to stabilize the humerus and apply resistance just proximal to the wrist. So resist me. 3, 2, 1. Go back down. Now I will test for the brachioradialis, thumb in the air. So full range of motion, go ahead and do that for me. So once again, that's a 3. Come up halfway, stabilize, resist me 3 seconds. 3, 2, 1. Go back down, and the brachialis will be palm down. Come up with the palm down, full range of motion. Back down. That is a 3 once again. Come up halfway, stabilize, humerus, press down. 3, 2, 1. Depending on her resistance against me, I will rate her a 4 or a 5 for each one of those muscles. Testing elbow flexion, gravity eliminated position. Patient will be in a seated position, arm and forearm fully supported as shown here. When testing for this, we will be testing 3 different muscles. We will be testing the biceps brachii, the brachioradialis, and the brachialis. First, we'll start with the biceps brachii. Her thumb will be pointed towards the ceiling, and she will simply perform elbow flexion while in this position. So go ahead and perform elbow flexion for me as far as you can go, and bring it on back. Because she was able to perform elbow flexion at all, we would grade that as a 2. If she could not, I would palpate right here on the biceps brachii. If I feel this muscle firing, that'd be a 1, and if I do not feel it firing, that'd be a 0. Next one is the palm will be flat, and then she will this one will be the brachioradialis. Go ahead and perform elbow flexion for me, and then bring it back. Because she's able to perform that range of motion at all, that would be a 2. If she could not perform that range of motion, then I would palpate just distal to the cubital fossa right here. I would be palpating the brachioradialis. If I feel this muscle firing, that'd be a 1. If I do not feel it firing, that'd be a 0. For the final one, I will have the palm inverted facing outward. So go ahead, it's kind of an awkward position. And then this is for the brachialis. So go ahead and bend your elbow again for me, please. And now bring it back. Once again, any range of motion while in gravity eliminated position would be a 2. If she could not do any range of motion with that, then I will palpate for the brachialis, which is just distal to the biceps tendon, right here, right about the crease of the elbow. If I feel this muscle firing, that would be a 1, and if I do not feel it firing, that it will be a 0.